takeaways for me today was that we really struggle with the fact that as a society, we want these advanced treatments. We want advances in biomedical sciences. We fund it with our taxpayers' money. But then when it comes to the point of paying for them, suddenly we become reluctant. And what are some strategies that we could use to overcome that, to work with CMS, to work with private payers, to convince them that these are major advances to the benefit of patients, to our benefit, to the benefit of clinicians, and then ultimately these treatments will get paid for.
Yes, I agree with you. I think the analogy that the conference ended on, which was you need to have the designers, the architects, and the carpenters all in the same room to have the conversation, was very apt. And I think that the whole day actually reflected that, right? No one really had a problem with the fact that there are these advances. Everyone wants to have them. It's really thinking through how do we kind of get them out there in the system we have and the ways we have in a way that we can maximize the number of patients we can get to in a safe way. And I think that was really exciting to see and good conversations to participate in.
We need to find better ways of valuing these treatments, and not just the treatment itself, also managing the side effects, which can be pretty significant, and find ways that we look at the total cost of treatment and can say, yes, this is worth it, in ways that puts patients first and clinicians second and providers third.
No, I agree with you. I think those discussions were very fruitful, and the insertion of telehealth into the middle of all of this was amazing, right? So kind of the idea of getting telehealth in place, so you can get a 24-hour view of the patient. So it's not just about when they're in the cancer center or the community center outside of business hours, and doing that in a way using some of the new CPT codes that are reimbursable and can get billed, and putting those educations in place was a really great way to kind of get there. And I think that's eventually how we'll get to the value-based approaches that we need to have in place for the long term for these therapies.